Habari ya leo tena mpendwa wangu, na nikukaribishe tena katika sehemu yetu ya pili ya history taking, the practical points of history taking. I thought to discuss about this because I have come to learn that majority of junior doctors wanapokuja kwenye clinicals, they really struggle. Yes, they have learned in school, they have learned in the clinical years, but still when they come now, they have a patient in front of them and now it's them to identify their patient's problem. They really struggle with history taking. So I thought maybe we can discuss, and this could be a platform where you can ask questions and then tunaweza tukajifunza kidogo kidogo. Sasa leo katika sehemu yetu ya pili ya history taking, nimefikiri tuzungumze kidogo. Unajua history taking inakuwa ina mpangilio. Ni muhimu sana as a junior doctor, kabla hujakomaa bado au kabla huja grasp namna yako ya kuchukua history, ni muhimu sana ukawa systematic katika kuchukua kwako history. Yaani rudia system ile ile kila siku. Rudia system ile ile, jitengenezee mara nyingi katika hospitali nyingi utakuta kuna utaratibu ambao umepangwa kwa ajili ya history, ufuatishe kila siku. Ni muhimu sana. Sasa katika sehemu ya kwanza tulizungumza jinsi ya kuanza katika kuchukua history. What are the key points in starting taking the history of your patient? Because unapochukua history, you're trying to understand your patient and you're trying to see that you can come up with the diagnosis. Okay? You're trying not to miss your patient's problem. Kwa hiyo ile ya kwanza tuliongea ile mwanzo kabisa wa history taking, what to do. Leo ninataka tuongee kuhusu the main complaint. Now, kwa kawaida taratibu ambao uko katika vitabu vyetu unasema utaanza na demographs za mgonjwa wako, halafu utafuatia na main complaint, and then uta amplify the main complaint, halafu uta review systems, halafu ndio utakuja kwenye past medical na family social history kabla ya kuanza examination. Na kwa kawaida inavyoshauriwa, once you've done that, tayari unatakiwa ufanye nini? Summary ya history. Umeshachukua zile zote, unafanya summary afu ndio unaenda kwenye examination. Huo ndio utaratibu unaofahamika. Sasa leo ninataka tuzungumze kuhusu the main complaint. Now as a doctor, hautachukua tu kila kitu mgonjwa wako anasema, lakini pia hautaacha kitu mgonjwa wako anasema. When you're taking your history, you are going to be making sense of your patient's explanation. Vile mgonjwa anakuambia, wewe kama clinician kazi yako ni to make sense out of their complaints. Now, the main complaint, that's the most important thing. I really like the main complaint kwa sababu kile utakachokiandika kama main complaint should be able to tell you 3 very important things, na hii ndio itakayo set base ya history yote. So the first thing that the main complaint should be able to tell you is the reason why your patient is at the hospital at this moment. Now this is very important, especially kwa wagonjwa ambao they have chronic comorbids, they have other diseases that they're having for a long time, and now they have decided to come to the hospital, or there is a reason why they came to the hospital now. It is very important. You should understand what made them come to the hospital this time. Okay? So that will tell you how do you manage them differently, or what else do you need to do differently. And it will help you not to miss any problem on your patient. So the first thing, it should tell you the reason to why your patient is at the hospital. The second thing, it should be able to tell, you should be able to identify the affected system right from the main complaint. This is very important. You should be able to identify the affected system on your patient right from the main complaint. Nitakupa mifano michache labda, lakini pia nafikiri nitakuwa naendelea kutoa mifano kila mara. And the third thing that your main complaint should be able to tell you is the possible diagnosis. Yani ni hivi, zile main complaint zako utakazoziandika pale juu, your diagnosis should be spoken from there. Kwa mfano, kuna wakati unakuta mgonjwa anakuja, complaint yake ni kikohozi. Umenielewa? Halafu diagnosis inaongea UTI. Unashindwa kuconnect kati ya kikohozi na UTI. Hakuna chochote kinachoonyesha UTI kwenye main complaint, lakini unakuta mtu kakuwekea diagnosis ya UTI. Au unakuta mgonjwa amekuja, complaint yake amevimba mguu. Okay, na kunatoa tu mifano. Amekuja amevimba mguu. That's the main complaint. Painful swollen lower limb. Okay, or painful swollen leg. And then the diagnosis unakutana nayo ni malaria. You understand? It's not reflected on the main complaint. Hapo tayari kuna tatizo. Sijui kama mnanielewa. Kwa hiyo ninapenda ufahamu, this is very important. Your main complaint should reflect your diagnosis. So you're going to be thinking about the diagnosis right from the main complaint. Umenielewa? Don't just come up with the diagnosis from nowhere. Mgonjwa anakuja with headache. They're having very severe headache. And that's the main complaint. Okay? And then the diagnosis is gastritis. It's not reflected anywhere. The headache is not connected to the gastritis, and the gastritis is not connected to the headache. There is no connection. That is something that I really want the junior doctors to understand, and this is very important. Understand that your main complaint has to connect with your diagnosis. Your main complaint should be able to speak to the affected system. Your main complaint should be able to identify the possible diagnosis. So your diagnosis is going to come there. Now, there are some complaints that are very broad. For example, fever. Fever is very broad. Fever, it can be from any system. Fever can be from the head or the CNS. It can be from the respiratory system. It can be from the GI, from the genitourinary. It can be from the heart, cardiovascular. It can be from dermatological, from musculoskeletal. Fever can come from anywhere. Now, if your complaint is fever and you want to focus, if you're able to focus, that is, and you want to focus your main complaint, your next complaint should reflect the affected system. So for example, fever and cough. That means the possibility, in your mind, you're thinking that the fever is coming from the respiratory system. Okay? Or fever and flu, you think the fever is probably coming from the respiratory system. If the patient is having fever, diarrhea, and vomiting, you're probably thinking the possible diagnosis, the possible system that is affected is the gastrointestinal system. So you're going to be clarifying the fever from there. But sometimes you cannot clarify it. It's fine. But when you come down to amplifying the systems, you should be able to exclude every system that can possibly give you fever. Now, the best way to handle or to deal with complaints that are broad, things like fever, headache, vomiting, these are broad. You know, a patient with kidney problems, they may be having vomiting. A patient with malaria, they will come with vomiting. A patient with gastroenteritis will come with vomiting. A patient with CNS problem will come with vomiting. So these are complaints that can affect any system. The best way, I usually say, to deal with such complaints is to try and pair that broad complaint with the possibly affected system. Now, I want you to remember, when you're taking your history, you are not writing like a robot, okay? You're writing, you're listening, you're writing again, and you're making sense, you're thinking, you're trying to make sense out of your patient's explanation, and then you go back to your history. So immediately you discover that your patient's complaints, they can come together. For example, a patient who comes with a lot of explanation, but at the end of the day, you realize they're actually having cellulitis. The cellulitis is the reason why they have fever. And out of their complaints, they have fever, they have body aches, they have backache, and then they have swollen lower limb. You probably want to put the complaints that gives you a clear diagnosis together, and then the complaints that are vague, you put them separately. I think I will be coming with some examples with time, especially on this, because I tend to feel this is the area where a majority of us tend to fail, and we miss our patient's diagnosis quite big. So what am I trying to tell you? Number one, when you're taking your patient's complaint, the main complaint, see that it is telling you the reason why your patient is at the hospital. See that it is telling you which system or systems are affected. And remember, there is that principle of not more than 4 complaints, because if you have more than 4 complaints, our teacher used to say you're lacking focus. If you're having too many complaints, you're lacking focus. But if you're focused, if you take time to critically think about your patient, you will realize majority of the time your complaints are not going to be more than 4, okay? And then see that your main complaint is reflecting your diagnosis. You are going to think about the diagnosis at the main complaint. Now, when we were in school, one of our professors used to say, once you're done writing down your main complaints, on the side, make a list of at least 10 differential diagnoses that you will be able to clock as you go down. So we used to write main complaint, and then you write down possible differentials, all the diagnoses. So for example, your patient is having a headache and flu, let's say, headache and flu. You write all the possible diagnoses that might be related to the headache or to the flu, okay? And then when you're clocking downwards, then you know if you're, let's say, if they're having headache and flu and you're thinking they could be having sinusitis, they could be having malaria, they could be having upper respiratory infection, lower respiratory infection, whatever that you're thinking, you have written them down there. When you're clocking, your history is more focused, okay? So you know the systems that you're going to be looking at. You know you're going to be looking at the CNS, you're going to be looking at the respiratory system. At least at that moment, you know what you're going to be looking at, okay? So it's very important that your main complaint gives you the affected system or systems, and it gives you the possible diagnosis. Make sure your diagnosis is reflected on your main complaint. I am insisting on this because it is something that I have talked about, I have been teaching about, and it has been a big issue, a big problem to our patients who come in with missed diagnosis. I hope this was helpful. I will keep giving examples as we go, but today we have been discussing about what things the main complaint of your patient should tell you. Please remember to subscribe. Please write your comments down. Let us know, or let me know, what can we discuss? How can we improve this discussion? Because this is a discussion, and I believe with time we will be having you around so that we can discuss together, so that we can improve our care to our patients. And that's the aim of these sessions.